Hello and welcome. Today we will talking about topic very intriguing and interesting. In fact, we'll talk about how much can art be a tool for medical and health education. I'm pleased and honored to have Dr. Giampaolo Martinelli with us. He is consultant cardiothoracic anaesthetist at St. Bartholomew's Hospital in London. Thank you so much for taking the time to join us. Let's go to the first question. Doctor, how much can art be a tool for medical and health education? Thank you.
I think art has been connected with medicine since all the time. And just to mention, I always say that even the Greek time, Apollon was the god of beauty, but also was a healer himself. In fact, he was considered to be a healer. And at the same time, even Saint Luke, which was a doctor, he was also an artist. And so the two things were connected. And why is that? Because I think art per se is a healer. The art heal people, and we need art as a human being, and we know how important it is for us. But can art be utilized also in different kind of field, also in medicine? I wanted to quote Leonardo, because Leonardo da Vinci, which is the scientist of all time, used to say that the capacity to see is the capacity to unify between themselves phenomena that apparently could be separated. So the medicine has to connect itself with art a lot, because we need to observe. And the best capacity of a good doctor, to me, is being able to observe and unify phenomena and make a diagnosis.
Okay, thank you so much. If there were no artists, doctor would not have been able to study the human body. How much remains in the doctor of art of observing? Thank you.
Yeah, so it is true. If we didn't have this fantastic artist able to reproduce the anatomy, we probably the doctors wouldn't know how to recognize, how to study the human being. So, and again, the anatomists were not. The anatomy was not allowed the exploration of the human body, because the church was against it during the Middle Age. So they struggle a lot, because there were also some taboo, opening the sacrality of the human body. But again, to the artists of the Renaissance, and Leonardo da Vinci was one of them, they created an immense heritage of art, and the doctors could eventually try to understand and study more and more and more how the human body would work. And then you were asking if today we have lost this capacity. I recently came across to the fact that the people, doctors look at the patient in a 24 hours time. The junior doctors, only 12% they spend the time close to a patient, and 40% in front of the computer analyzing data. So the capacity to be close to a patient and to observe is probably reduced in comparison with the past, when the doctors has to be in front of the patient, try to analyze and try to understand the science, the semiotic of the body, which is actually now a discipline that is probably disappearing.
Thank you so much. What can you tell us about the use of the visual thinking strategies method in the medical education field? Thank you.
Yeah. So from just connecting what we were saying before, the ability, if a doctor stay in front of a computer and distracted by all sorts of data set, the ability to listen, problem solve, and think creatively is probably reduced, because if you are glued to the screen, you cannot do that. So there is a room of the utilization of visual art in medicine. There are lots of schools in America and also in Ireland that they provide visual studies in order to improve the capacity of the students to recognize the disease, so improve the clinical skill, but also improve communication, encourage critical thinking and problem solving, promote empathy, ambiguity, team working, all these kind of things that I'm talking about, they have been proven. So there is a recognition that exposing students to the visual art will enhance all of this capacity, basically allow the students to slow down and apply contemplative process examining a patient. And the VTS is called Visual Thinking Strategies, utilizes this three simple questions, which are what's going on in this picture, and what do you see that makes you say that? And what more can you find? And with these three questions, basically, there is no right, no wrong. You put your students in front of that, and everybody's at the same level, more senior, more junior, and with the common ground, we discuss that. And then it's basically enhancing the capacity to see and to talk to each other. And because, you know, sometimes the doctors have got friction between specialties, they don't talk too much. And this is basically, you just reduce the barrier and you carry on talking.
Thank you so much. Let me introduce Francesca Robolotta, President iWIN and Director Intensive Care Unit at McGill University, Montreal, Canada. She's just arrived. Good morning. For you, not good morning. Thank you so much for joining us, Francesca. We just have the interview. Do you want to ask something? Thank you so much.
Yes, I want to thank so much and for doing this interview, because I think the topic is very relevant, and hopefully we can try this method also next year, hopefully with our iWIN meetings. So just on time to thank you all and for this fantastic initiative.
Thank you so much, Francesca. And I think I would definitely be interested. We could do a workshop, and then perhaps linking even with the museum, and then we can do basically things with all the people that are at the conference. Thank you so much for this opportunity again.
Thank you so much. Bye.
Bye-bye.
Bye-bye.
Bye-bye.